We have a new Chief Human Resources Officer. We have a new Developmental Disabilities Director. We have a new electronic health record system entitled Avatar, not to be confused with my favorite movie. And DCSB-TV has a new set. This episode is packed with new information to keep you in the know. Let's start the episode.
This episode of DCSB-TV features interviews with the new Chief of Human Resources, Tia Plunkett-McQueen, and our new Developmental Disabilities Director, Keith Ricketson. The Avatar team is in the studio and ready to launch, and our Community Relations Manager is making her final appearance. DCSB-TV starts now. Here's your host, Maurice Townes.
I am completely loving this new marquee. Our new sign was designed and created by my fiance. Just in case you all have not heard, I got engaged on Christmas Day. But enough about me. Avatar is coming. It's practically here. No, I am not talking about my favorite movie, which includes the planet Pandora and the Na'vi. What I'm talking about is our new electronic health record system that is entitled Avatar. Alicia Blanding, we know her as AJ, and Mary Kay are in the studio to update us on the launch of Avatar. But first, here's a message from Henry Angel regarding your ID badge. Some of you have not updated your ID badge. Can you believe that? You haven't updated your ID badge yet. So Henry is here with a message, and when we return, my new boss is in the studio right now. Tia is here. I'll introduce you to her. But first, here's Henry. We'll be right back. Henry, what's going on with our badges?
Hey Maurice, we have new ID badges for the agency. The new badges are blue, and not everybody in the agency has those new badges.
Still?
Oh yes, so I need everyone to give me a call so we can get you set up for an appointment to receive those new badges.
Okay, so if your badge does not look like the badge that is displaying on the screen right now, you need to give Henry a call immediately. Henry, and that number is?
404-294-3745, and my extension is 3921.
Okay, that number's at the bottom of your screen. Once again, if your badge does not look like the badge that is displaying on the screen right now, give Henry a call immediately. So when is the due date for this?
Well, we haven't set a due date, so we would like to get it done as soon as possible.
Okay, so ASAP.
Yes.
So the due date is ASAP. Okay, Henry, thank you.
Thank you, Marie.
Avatar is our new electronic medical record system, and it does a whole lot more than that. I have two of Avatar's team members in the studio with me today, and I'm very excited about it. The successful journey of this project started off just a little rocky, but now they're completely on track for a successful implementation. AJ is right here with me, and I'm excited that you're here.
I'm excited too.
Very well. I know you're very excited about Avatar, because everyone is waiting to hear all about it. So your position with Avatar is the project coordinator?
The administrator.
Project administrator.
Yes.
So what exactly does that mean? What is your role?
Basically, I maintain the schedules. I make sure that the tasks that we have scheduled are getting completed, that we stay on task, that pretty much almost project management, but just a smaller scale.
Okay.
Yeah, so Angela Carter is the
Right.
project manager, so I'm under her and I operate under her, and just kind of make sure that we get the documents that we need.
Right.
We communicate with NetSmart, somewhat of a liaison between DeKalb Community Service Board and NetSmart, who produces the software Avatar for us. And so that's pretty much what I do for the project.
I know in the intro I said that Avatar was our electronic medical record system, but it does more than that.
Yes.
So tell us some of those other things that it's doing, because it's going to affect every employee that we have at the agency, correct?
Right. So basically, Avatar is going to be our new CMHC. So Avatar, to me, I like aesthetics. It looks a lot better than CMHC. To me, it's easier to navigate based on the little that I know about CMHC. But you have the widgets on your home screen, and it's kind of like apps, like you have an app for that on your phone.
Tablet.
Yeah. So if you've ever seen the Microsoft layout, how they have the apps kind of like that, that's kind of how the Avatar system looks when you
Excellent.
first get into it. And so you'll have like your calendar here, or depending on what role you are, depends on what you have on your home view.
Okay.
And so it's easy to navigate, so you can just, with the click of a button, you can go into a client's record, or you can schedule an appointment.
Excellent.
So it's a very nicer way, an easier way to keep up with what your role has to deal with.
Okay.
Yeah, and so it's going to be tailor-made, especially for each role. So a clinician's home view is not going to look the same as the front desk.
That's excellent.
And
So it's customary.
Customary,
Okay,
yeah.
and
it's
that's part of the
customized.
development of Avatar for us?
Well, it's a part of the package.
Okay.
And I believe you can add widgets to your home view based on your roles, what widgets you have access
Okay.
to, and you can add those to your home view as well.
So I know what a widget is, but there are employees of ours who have no idea what a
Right.
widget is. So what's a widget?
Widget is the same thing as an app.
Okay.
Basically, if you click on it, it's going to take you to wherever you're trying to locate. So like I
Okay.
said, with the calendar, if you see your calendar, you want to click on the calendar, set an appointment, that's what that widget will do for you. If you have like I think there's a widget where you can set up a particular client. If you click on the client, it'll take you to that client's file.
Okay.
So the widgets are basically just there to help you navigate throughout your
Okay,
processes.
and through Avatar. So I know you have a dynamic team.
We have a super team
of dynamic
yeah,
people. I know
dynamic people who
a few of them
work so hard and have been working so hard and dedicating so many hours to getting Avatar up and running, and they have just been awesome, and we are looking forward to having a successful implementation. And so the super group will also be there the first week, so we want to make sure that people know that we will be holding their hand during the first
Right.
week, and
Which
that
is
we will
good.
be available for them when we do go live.
I'm one of those type of users and those type of employees that once you start at DAC, may I come over and take a peek and see how it's going? And I think that's a no.
It can be considered. I would have to
Okay.
check with the team.
Okay, understood. I will not bring any cameras.
Okay.
I just want to come and say, hey, because I love being a part of implementation teams.
Okay.
I think it would be
Okay.
fun. Thank you so much for stopping,
Thank
and I really
you.
appreciate it.
Thank you.
And then I get to talk to your super user right now.
Yeah.
So up next, I'll have Mary Kay. She'll be here to tell us about Avatar from a clinician point of view. Our super user, Mary Kaloje, is here, and we know her as Mary Kay. She is making sure that everything is set up properly when Avatar's implementation is launched. Mary Kay,
Yes.
good to see you.
You too.
We've done a lot of things together in terms of testimonials and things like that.
Yes.
So welcome to DCSB-TV. Is this your first time actually on the show?
Here it is.
Okay.
Yes, it is.
Okay. So you're the super user.
I would say I'm the clinical super user.
The clinical super user.
Yes.
Okay.
Yes.
So tell us about that. How has that been going? I'm sure that's been a lot of fun getting things set up, working with doctors. And
Absolutely. It gives me a very up and close behind the scenes look of Avatar.
Okay.
So I've had the pleasure of working really closely with our doctors and our clinicians as to what they want for Avatar. So, obviously we have CMHC and we've been functioning on CMHC for a while, but when we moved to Avatar, we wanted to make sure that it wasn't just kind of a copy and paste, that it truly was an enhancement for clinicians and clinical staff. And so with that, that's required me to have a lot of contact with doctors, nurses, clinicians. What do they want? What's going to work for them with assessments, the treatment plan, scheduling even. I kind of dipped my toe into that a little bit with the front desk, but making sure that this is definitely an improvement for them and that this is an enhancement for them.
what's the number one improvement that they will see that they will love from your point of view?
I would say, and I think Alicia mentioned it earlier, it's aesthetically pleasing, it's user friendly. So a clinician, a physician can jump from one client to the other very easily. They can have multiple things pulled up if they need to.
At one time?
Absolutely. So it's not
Excellent.
limiting them to the treatment plan that's in front of them or to the progress note that's in front of them. It allows them to really look at the client chart and access and move through it really easily. It doesn't require them to exit out, come back in. You don't lose your train of thought. You don't lose your focus with Avatar.
Excellent. Excellent. So the doctors are going to love that.
Yes. I mean, it's just, as a clinician seeing it, I'm very pleased with it. So one of the things that we have in Avatar, which is a little bit different from CMHC, and as I said, we don't want to just copy and paste it into Avatar,
Right.
is that instead
And I
of...
have to say this, every time I hear Avatar, I see the blue people.
Yes, yes.
But go ahead. I had to throw that in there. It's my favorite show.
It does kind of have a blue tint to it, no.
Okay.
But so we have menu screens in CMHC, and we have something very similar to that in Avatar, but it's actually, they're called bundles. And so for different assessments, we'll have bundles. So our 1001 will have a bundle. Our 1002 will have a bundle.
Okay.
And what that basically looks like is on the home screen, there'll be tabs that clinicians can float through. So like I said before, you're not locked into one screen. So you can actually go from one screen to the other and go back. So if a client gives...
it's very dynamic.
Absolutely. So if a client gives information and it's not in this, concise or kind of specific way, which most clients don't do,
right,
you're able to really capture that information without having to go back and redo an assessment or append an assessment. It allows you to enter that information before you submit it. So they just click from tab to tab. It's going to pull up the information that they need, and then they submit it at the end. So and that's why I say it's user-friendly, because it allows you as a clinician to really do your job without having to be kind of held captive to what the screen is telling you to do.
Right. Has any of the doctors had sort of a sneak peek?
There are a few physicians that have had the opportunity to see it that I hope have given their stamp of approval, but no, that have been really pleased with some of the changes that we've made that really took into account what works for a physician, and making sure that things are compatible with how they see clients, instead of having, like I said, having to stay with what the screen's telling you to do.
Right. What do you think will be the most challenging for you during your implementation and testing as a super user?
I think with the implementation, it's just going to be that it is a different system. So there are a lot of improvements, but with anything new that you learn, you have to adjust, and you have to kind of, you're comparing it to how it was. So I think a lot of people will have CMHC in the back of their mind, and they'll be able to see how there's some overlap with that, and then some things will seem completely different.
Okay.
And so I think making sure that everyone, takes this as a system, a standalone system, is going to just be the hardest thing, just because it's what they're used to is CMHC.
Now, should they have the history of CMHC in their mind, or should they just flush that and come in completely fresh and new?
Fresh and new. So Avatar does what CMHC does as far as, we have the clinical piece of that. You have your assessments, your notes, you have all that. We have our billing, we have our front desk. All of that is contained in Avatar. So it's its own entity. So coming forward and looking at this, take this as what it is. So this is its own...
A new system.
Absolutely. A fresh new system is the best way to look at it.
So this is really going to enhance the job for all of us. And it's going to also enhance our revenue. Because we'll be able to see more clients. We'll be able to move quicker in what we're doing.
And that's definitely the goal, is to make this as user-friendly, especially for those that are face-to-face with the clients. So it's really letting them focus on the clients in front of them, instead of having to focus on, what do I need to complete? What do I need to do for this screen? It's really trying to make the clinician's life easier. That's kind of been the focus as the clinical liaison, is making sure that this is what would the clinicians want.
Okay. Okay. Excellent.
Yes.
Well, Mary Kay, I did ask this of AJ, and I'm going to sneak and ask you this.
Go ahead.
When the implementation is kicking off, may I come in and take a peek and maybe look around?
We'll have to see.
Okay. I promise I won't bring any cameras.
Okay, sounds good.
But thank you so much for stopping in and telling us all about Avatar.
Thank you for having me.
And will you be back when we talk about the second phase?
Probably. I will have some toes dipped in that as well.
Good,
so absolutely.
Good. So folks, we are up to date on Avatar, and I'm very excited about it. I cannot wait to get into the implementation. They're going to let me in. Pray they will let me in, because I want to get in. I'm here with our new Chief Human Resources Officer, Tia. Welcome to your first appearance on DCSB-TV, and welcome to DeKalb Community Service Board. I'm completely excited you're here, and I'm very delighted you've selected us.
Well, thank you, Maurice. I'm glad to be here.
You have jumped right in, and you're fully, folks, she's fully and completely engaged. Your background is very impressive, so share it with us.
Well, as a human resources, human services professional, I've been in this sector of the industry for over 20 years. I was fortunate to have the opportunity to work in human services very early in my career, in the Washington, D.C. metropolitan area.
Wow, that's my hometown, folks.
And so worked with a number of different nonprofit organizations providing services to foster youth, to adults and children with developmental disabilities, to other at-risk populations, including substance abuse, as well as HIV and AIDS. So I feel like I'm coming home.
Yes, I told you her background was very impressive.
To DCSB, and I'm really, I feel it's a fortunate opportunity, and I look forward to a long, mutually productive working relationship.
Because it's an awesome fit. It's a great fit. It fits like a hand in a glove.
Right.
And you have started some wonderful initiatives, and of course I know what those are because I'm in human resources. So share some of those initiatives with our employees.
As you know, Maurice, a lot of our focus over the past couple of months has been looking internally within human resources to look at our own processes and systems to determine ways in which we can streamline, work more efficiently, and eliminate redundancies. And so with that, we are going to always focus on, what's our theme? Continuous improvement. That way we're freeing... I do too. That way we're freeing up the HR staff to really work and serve as strategic partners to both staff as well as leadership. And with that, when we're focused on looking forward, our FY15 priorities will continue to look at our infrastructure. And one of the aspects of our infrastructure that we'll focus on is data management, all being managed by one central area within the department.
Excellent.
Also, our focus on our talent acquisition, which is extremely important. We want to not only attract, retain, and recruit the right staff for the organization, but we also want to be focused on employee engagement, as you know.
Exactly.
Really,
employee engagement. Remember that word.
Employee engagement. As you know, you are serving as a champion in that area, making sure that we are actively engaged in communicating to employees what the priorities of the organization are, and really getting their input, recognizing them for success on the job through employee recognition.
And you all are going to love this. You're going to love that.
Appreciating the level of diversity within our workforce and with a focus on cultural competency. And then also making sure that we are engaged. We do good work here, but we also want to continue to do good work in the community outside of the DCSB community. So really excited about those opportunities and glad that you're one of the champions over them. Of course, since we're heavily regulated, we're going to also focus on HR's role as it relates to training and compliance, which is a huge critical component.
Very much so.
As you know, we've had a number of different audits, and so we want to make sure we're doing everything we can to ensure that DCSB does well as it relates to audits. Okay. So again, continuous improvement.
Continuous improvement.
Automating our processes. Freeing ourselves up to be more in the field, working with both staff and leadership, and really working with leadership to ensure that we are able to move the organization forward.
Good. Well, welcome aboard, and I want everyone to know that Tia has an open door policy. Whenever you want to stop by Human Resources, please stop by, introduce yourself, say hello to her.
Absolutely.
We're so delighted she's here. Welcome.
Thank you. I'm glad to be here.
And I know you'll be back on the show. She's one of the EPs of the show, folks, so she'll be here quite a bit.
But also, I plan to be out in the field as well. So I hope to visit the programs and get to know the staff and the management, program managers, and the center directors. So if you can't come to the central office, look for me out in the field.
Okay. Thank you so much.
Thank you.
So I'll see you at our next meeting. I'm here with our new Developmental Disabilities Director. He started a few weeks ago. Keith, welcome to your first appearance on DCSB-TV. Welcome to the DeKalb Community Service Board, and welcome to Atlanta, Georgia.
That's a lot of welcomes.
Yes, it is. That's a whole lot of welcomes. We're delighted you've selected us. I stated that earlier to the Chief Human Resources Officer, my boss, Tia. We're delighted she selected us, and we're definitely delighted you selected us as well. I know you're from Massachusetts. Your family's still there. You also spent some time in Maryland. So tell us a little bit about your past.
Well, I've been in the field for more years than I'm willing to talk about.
Okay, understood.
Started out working in Massachusetts in the very early stages of when they started moving people with developmental disabilities out of the institutions and into the community. Did work there for several years in primarily residential services. In the early 80s, I moved to Southern Maryland and took a job doing the same thing for an agency in Calvert County.
I know exactly where that is.
The Arc of Calvert County, which is now the Arc of Southern Maryland. Stayed there through about 87. Moved back north and went to work in New Hampshire.
Okay.
Doing several different jobs, but primarily in residential services for people with developmental disabilities.
Okay.
Stayed there a year. That was not my best experience.
Understood.
Came back to Massachusetts and worked for the last agency I just left for 13 years.
Wow.
That agency was very much involved in doing work for people who were coming out of nursing homes,
Okay.
who had extensive, at times, medical needs and needs for support in that area.
Right. Okay.
For 13 years, we specialized in developing services for that population and became sort of the experts at that around the
Yes,
state.
I know, because Massachusetts is the place that every other state looks towards for developmental disabilities. And so, with that alone, we are very honored that you're here.
Well,
And we know that we're in excellent hands. We're in excellent hands.
Well, I hope the bar isn't set too high, but we did a lot. I mean, in 13 years, we opened up at least 4 new homes per year.
Wow.
We expanded to 13 day programs during that time. We ran. I mean,
Yes.
we just moved and moved and moved and got lots of people out.
Good. And so you've already have a proven track record, and we cannot wait to get massively started with you. But I do want to ask one quick question. How are you going to deal with being in Georgia and no snow?
I'm gonna thrive in Georgia with no snow.
Okay.
We had about the worst winter we've ever had in Massachusetts last year.
But the funny part is going to be, especially when your family gets here, the funny part is going to be when they close schools because it's cold.
Yeah.
No snow.
Right.
It's just cold.
Yeah, I've heard that.
Yeah.
I think that's kind of funny, but
I do too. Well, being from Maryland, we both would think that's funny. Well, being from the Northeast, we both would think that's funny.
right.
So today, some wonderful, exciting things happened. I know you and Dr. Bonner was...
They did. Dr. Bonner and I had the opportunity to go and meet with the commissioner, as well as some of the other high officials in the state around DD services. And we talked fairly extensively about perhaps becoming the model, if you will, to develop services for people coming out of the hospitals with intensive medical needs. And he's interested in us perhaps being sort of the demonstration of how it can work and work well. We're going to begin sort of in-depth discussions about that around or after July 1st when they finish the fiscal year. He wants to hook us up with a consulting agency that they're working with. And I think it's going to be kind of exciting to...
Oh, that's beyond exciting, to say the least.
Yeah,
I mean, beyond exciting.
And so, that's kind of work I like doing.
Yes.
And
you're extremely qualified for it.
Well, I've been doing it.
Yes.
I mean, we had a team doing it. It wasn't just me.
Right.
But I certainly know what's involved and what needs to be done.
Yes.
So
that's exciting, Keith.
Yeah, it is. It really is.
It is, because one of the things that you all have always heard me say is that the DeKalb Community Service Board, we are the leader in terms of CSBs throughout the nation. And the things that we do, a lot of the CSBs will look towards us. But this is going to really propel us even beyond that, which I think is outstanding.
Well, I'm anxious to get started with it.
I know. I can feel it. I can see it. I definitely want to thank you so much for stopping in and saying hello to us. For all of you, Keith has an open door policy. He is our new Developmental Disabilities Director. When you're at headquarters here on the 4th floor, stop by and say hello to him.
Absolutely.
Welcome aboard, man.
Thank you very much.
Okay. I'm here with our Community Relations Manager, and this particular moment is extremely bittersweet for me because this is her last appearance on DCSB-TV. And as you know, our community relations manager is the one that is responsible for all the activities that we have here, and mainly the one that I love a lot is the Walk of Heroes. She has been an integral part in making sure that has been a tremendous success for the DeKalb Community Service Board. So, without any further ado, Michelle, welcome to your last appearance on DCSB-TV.
Oh gosh, Maurice.
I know that sounds kind of weird, doesn't it, your last appearance, because we're always so busy doing things. I mean, I remember when we did one of the first large events that was really fun. For those of you who are new to the agency, you have no idea what I'm talking about, but we do have a clip. So Jordan, if you could put the clip up, that would be great. This is from the raffle, the live drawing that we did for the raffle for the first raffle that we did here. Was it in 2010, 2011? I don't even remember. And we're on the clip. I'm joined by Michelle Potter.
Hey,
Michelle. Hey, Michelle. Hey, baby. How you doing? Good to see you.
That hat looks great.
You know we got a party going on.
Oh,
Okay,
yeah.
come on, dance. Come on. We gotta dance. Yes. Well, Michelle has a few announcements before we get to the raffle.
Maurice, those were some good memories. I loved seeing you in that top hat.
That was a blast. It was a talk of the agency, and it was so much fun doing it live.
Yeah,
We
it
did
really
live.
was.
Yeah, it was a lot of heartache, but we also got it done live. Well, Michelle, I know you're feeling bittersweet too.
Absolutely. I know I've had so many good memories just with the agency, and I love the staff and the clients and the cause. And
When it comes to the Walk of Heroes, my favorite moments, I have really two. One involves, of course, you, and one involves one of my old co-workers here. But the first one, I have to show the clip of Michelle. She has her sun visor on, the sunglasses. She's in event mode to get everything done, and I love that image of you. I love it. And every time I see you in that mode, yes, backpack and all, when I see you in that mode, I'm like, okay, leave Michelle alone. She's making sure it happens. And the other one I love, and she's no longer here, but she's still gonna kill me for this because she watches the show, is Roz on the massage table.
oh, right. That was such a good one.
Yes, I love that. I really love that. The walk. You know, we've moved from Winway to Kirkwood, so let's talk about that a little bit. And you're not going to be here for this walk.
I know.
But I know. It's bittersweet, but you're definitely going to wonderful things.
I know we've done some work to get it started, and so I know whoever comes and carries the torch will do such a good job with it.
Yes.
I loved when we moved to Kirkwood. I thought that was really nice.
I did too.
The route through the neighborhood was wonderful, and being able to showcase our Kirkwood facility. And then this year, the board wanted to see if we could do the event City of Decatur, and it worked out. You know, previously, several years ago, we were in the square downtown.
Right.
And this year, it's going to be in the Oakhurst neighborhood, which is just a great
Yes.
neighborhood with trails, historic homes. There's all sorts of restaurants and shops, and it's at Harmony Park there. So
Good,
it's going to
good.
be great.
Well, I have a secret question to ask you, and you can answer it in front of all of us, because we're all family, right? Are you going to make a small appearance? Maybe?
I don't know.
Okay.
I don't know at this time.
Okay,
But I will.
understood.
We'll
Well,
see.
Michelle, I will have to say, the person that will come after you will have some pretty large shoes to fill.
Thanks,
It's
Maurice.
been wonderful working with you during these years. I mean, wonderful. It's
We've
been a lot of fun.
We've had some really good times.
Yes, we have. We really have, with our interns and filming and doing testimonials and
yeah,
just
I love the
laughing.
testimonials.
Yeah, we just had a blast, and we've been all over. So I'm gonna miss you tremendously, and I'm gonna twist your arm about coming back at least, 8, 9 months from now, maybe 12 months from now, just to say hello, make a quick appearance.
Sure,
Okay,
absolutely.
Okay, good. Well, bye, my good friend.
Thanks, Maurice.
Yes. We'll be back right after this. Are you a member of a credit union? Did you know at a credit union you will find lower rates on credit cards, home equity loans, mortgages, auto loans, and personal loans? Again, you will find lower rates at credit unions as opposed to a bank. Atlanta Postal Credit Union is coming to DeKalb Community Service Board. Join Atlanta Postal Credit Union and refer a family member, and you both will receive $25. When you open an account with $50, you will receive $25. Don't miss this opportunity. Atlanta Postal Credit Union will be on our campuses from August 4th through August 15th. Additional information from Human Resources regarding enrollment visits will be released during the 1st of August. Food Truck Wednesday is here to save your midweek hunger. Wednesdays from 11 a.m. until 2 p.m., the food truck services of Gotta Have It and Nectar are in our DAC parking lot at 455 Wynn Way. Food selections are as low as $7. Here's a message from Chef Travis.
We do what we call globally inspired fusion cuisine, where we take two different cultures and kind of crash them together. Like today, we've got a Cuban braised, beer braised pork with a Thai spring salad. That's all in one bowl. It's really great. That one's very popular, but also the salmon and crab wrap, which has cucumber jicama slaw on it with a sriracha creme fraiche across the top of that. That's one of our most popular items too. And the salmon's actually grilled and then chilled, so it's actually a cold wrap.
Wow, that sounds delicious. Food Truck Wednesdays, gotta have it. Okay, that does it for this episode of DCSB-TV. Please make sure you have your ID badge updated. Again, your ID badge should be updated. I want to thank Keith. I would like to thank AJ and Mary Kay for giving us all the updates. And I want to give a special thanks to my new boss, Tia. Thank you all. And I want to thank you for watching this episode of DCSB-TV. Just remember, we're helping to make brighter tomorrows. You have an excellent, excellent day, and I'll see you on the next episode of DCSB-TV.